Welcome back, friends. This week is Mental Illness Awareness Week, and World Mental Health Day is October 10th. And we're so happy to welcome Dr. Robert Murry, PhD and Chief Medical Officer of NextGen Healthcare. Good morning. Thank you so much for joining us.
Good morning. Thank you for having me.
Well, I got to tell you, there's no bigger hot topic going on in the conversation of the world today than mental health. You hear about it every single day. It's so great that we're actually addressing it and what it means. And I think a lot of people still don't kind of grasp what it means to have mental health and put yourself in check. So I'm curious, what are some of the symptoms and signs of anxiety and depression that we can look for?
Well, the symptoms are very common. I mean, the CDC thinks that maybe a quarter of all US adults have these kinds of symptoms. And symptoms of anxiety and depression can be physical. They can be things like a racing heart rate or sweating or a sense of panic or pain. They can be trouble sleeping, fatigue, difficulty concentrating. They can be mood symptoms. You're feeling anxious, you feel a sense of doom, or you feel sad, you feel hopeless, or that you're not enjoying life or worthless. And then these can affect your relationships. They can make you irritable or anxious or angry or, more commonly, withdrawn.
Yeah, those are great signs to look out for because I feel I've definitely experienced some of those symptoms for sure. But how do you have a more effective conversation about mental health with your healthcare provider?
It's a very good question. I mean, those symptoms are common, but if you find that sort of mood is dominating your life or that it's affecting your relationships or your ability to do what you need to do, that is when you should reach out. And the best place to reach out is your primary care doctor. I'm a practicing family physician. Probably half of what walks through my office and offices of those like me throughout the country is related to folks' mental health. And you want to prepare for that conversation. The first step is just to decide you're going to have it, but be straightforward with your provider. You know, say, I think I might be having a problem with depression, or I might be anxious. Think about and tell them what kinds of symptoms you're having, things that might be related, maybe not, what kind of mood you're having, and especially tell them how you think it's affecting your ability to live your life and do what you need to do. Because help is out there, and that primary care provider is the first place to start to coordinate it and decide where to go next.
You know, too, Doctor, during the pandemic, we all found ways to visit with our doctors, like via Zoom, like having these visits. So I'm curious how technology is playing a role in providing mental health care treatment, primarily in areas that don't have a lot of access, experience and access with shortages of technology, or people with like mobility issues.
Absolutely. I mean, one good thing about the pandemic is that folks took those Zoom calls or those video visits and have turned them into a common way to treat people, both for physical and for mental health. So at NextGen Healthcare, we provide that kind of technology and other technology to doctors' offices and mental health. And 4.5 million visits, probably a quarter of them are for mental health. And as you say, it can remove the barrier that is transportation or being able to get into the office and provide you the kind of ongoing help for physical or mental health that you need in a way that is more convenient. Folks that have video visits for behavioral health, they enjoy those visits, and most of them want to continue. And the providers also feel that they can be very effective.
Okay, perfect, because I always wondered that because, again, I myself during the pandemic was doing online therapy. So is the online version more effective, as effective, less effective than in-person, face-to-face contact?
I think a lot of it has become preference. Surveys of patients who are doing online therapy, well over 3/4 of them find those visits effective and want to continue them that way, sometimes just because those barriers to doing it an alternate way are removed. But the providers themselves, including myself, really agree. Being able to check in with your patients more frequently, to see them in the environments where they really are, their home or their workplace, wherever those doing those visits, and you can see and watch them and help them over video just as effectively as you can in person. So it's really becoming a matter of choice.
Doctor, we're running out of time, though. But can you quickly talk about the group 18 to 29, why they're maybe having a higher rate of this anxiety and depression?
It's a good question. Nobody knows for sure, but that group got hit very hard from the pandemic, right? They're at this time in their life where they're supposed to be establishing connections and relationships in their private lives and at work. they missed out on a lot of that, and so that's left them without some resilience. You toss the economy in there, maybe some social media, and over 40% of folks in that age range are having these kinds of symptoms, and they're a group that we're especially reaching out to seek help because it is out there and they can feel better.
Thank you, doctor. Real quick before we go, where can people that are watching get more information about these services?
Well, I recommend they just go to cdc.gov/mental health. It's a good, reliable overview of where to start. And of course, if they're in crisis, the nationwide helpline 988 can be helpful.
Thank you so much,
Murry.
Doctor. We appreciate that. Mental health is on the mind of everybody right now, so we appreciate your time and your expertise.
Yes.
Absolutely. Thank you.
All right, you guys, coming up, Jeremy and I will play a round of remixed renditions, movie edition. This is going to be good.
I was half asleep today when you were
Get in the
talking about
mode,
it.
Jeremy.
I don't even
Get
know.
in the mode.
I don't even know what I'm doing.